Assalamualaikum and good evening, ladies and gentlemen. Welcome to our forum today. My name is Nurul AQILLAH and I am your moderator for today's forum. First and foremost, I would like to introduce to all of you to our panels for today, who will be sharing with us their knowledge and experiences on topic that we will be discussing today. First, we have medical geneticist Dr. Nurul Laily from Hospital Kuala Lumpur, medical oncologist Dr. Nur SYAHIRAH from IKN, then Professor of Pharmacy, Ms. Siti NURDINAH from International Medical University. Then we have Society Member from National Cancer Society Malaysia, Ms. Nurul. And lastly, we have a university student, Ms. Nur ATIAH from University Technology Malaysia. Thank you for joining our forum today. To give a brief introduction about genetic engineering, genetic engineering, or also known as genetic modification, is a process that uses laboratory-based technologies to alter the DNA makeup of an organism. This may involve changing a single base pair, deleting a region of DNA, or adding a new segment of DNA. For genetic engineering in gene therapy, in most applications, gene therapy can be defined as the transfer of nucleic acids to the somatic cells of an individual with a resulting therapeutic effect. Gene therapy is aimed at correcting genetic defects or to express gene products that are therapeutically useful. It represents a new innovative drug delivery system, making use of the technical and scientific advances, with one of them, among the others, being genetic engineering. Therefore, in today's forum, we will be discussing about the applications of genetic engineering in gene therapy. Without further delay, I would like to ask our first question to our first panel, Dr. Nurul. Doctor, as a medical geneticist, for sure you are the expert in gene therapy. Can you explain further what are the theories lay behind the gene therapy, such as the history of gene therapy?
Okay, first of all, thank you to our moderator for inviting me to this intellectual and informative forum. Let's start with Bismillahirrahmanirrahim. Nowadays, where many illnesses have been attacked our society in all stages of age, and a lot of initiatives and research have been made to create medicines for various types of diseases, and one of it is gene therapy. There is no question that genetic therapy has a potential to be the crowning achievement of modern medical science. The concept of gene therapy arose during the 1960s and 1970s and is still in its infancy, meaning there's a paucity or less of reliable long-term data on the safety and efficacy of this therapy. Efficacy in medical terms is referred to the ability of a product or treatment to provide a beneficial effect. The first patient to be treated with gene therapy was a 4-year-old girl treated at the NIH Clinical Center in 1990. She had a congenital disease called adenosine deaminase, ADA deficiency, which severely affects immunity and the ability to fight infections. For the therapy, her white blood cells were taken from her and inserted with the correct genes for making ADA and then re-injected into her. This process was performed by a doctor from the National Heart, Lung and Blood Institute. In 1985, the doctor and one of his colleagues started working together to demonstrate how cells from people with ADA deficiency could be modified in tissue culture. They used a retrovirus as a vector to carry the correct ADA gene into the cells. In 1986, they tried transferring the correct genes into the bone marrow of animals, but in 1988, found that transferring them to white blood cells was much more successful, with a dramatic increase in the amount of the correct genes being taken up by cells. In 1989, the researchers teamed up to test how safe and effective the gene therapy would be in cancer patients. The team cultured tumor infiltration lymphocyte cells TIL cells from people with malignant melanoma. A tumor usually occurs on the skin. A viral vector was made that would carry a DNA marker into those cells, and this marked cell allowed the researchers to see which TIL cells were the most effective and also confirmed that the engineered virus was safe for use in humans. In 1990, the 4-year-old girl and another 9-year-old girl with ADA deficiency were infused with their own corrected cells over 2 years, and in 1993, the team used the gene therapy to treat newborn infants with ADA deficiency. The corrected ADA genes were transferred to immature blood cells obtained from the baby's umbilical cords. Umbilical cords connect the baby to the mother's placenta. From this story, viral vector is one of the widely used gene therapy where the viruses have a natural ability to deliver genetic material into cells, and therefore some gene therapy products are derived from viruses. Once viruses have been modified to remove their ability to cause infectious disease, this modified virus can be used as vector, or best to know as vehicles, to carry therapeutic genes into humans. In addition, during my research about this gene therapy, I found the current gene therapy using viral vectors for chronic pain, which is herpes simplex virus 1, HSV1, the most common used viral vector. It offers the advantage of large packaging capacity as well as natural mechanism of targeting sensory neurons, resulting in episomal gene expression in the corresponding dorsal root ganglia. In a simple term, it is the nervous sensory in our vertebrate or backbone, and discrete dermatomal effects of expression of the gene product. The HSV1 viral vector strategy carrying the gene for proenkephalin or protein coding gene has been widely shown preclinically to reverse manifestations of chronic pain in models of inflammation, pancreatitis, spinal nerve and infraorbital nerve ligation, and bone cancer. That's all from me. Thank you.
Thank you, Dr. Nurul Laily. So I have been wondering about cancer because we know that cancer is caused by the change in genes that control the way cells grow and multiply. And we know that genetic engineering can help in modifying genes. So is there any applications of genetic engineering that can help to treat cancer? Perhaps Dr. ALIA may enlighten us?
Thank you, Ms. IFFAH, for the question. So first of all, I would like to introduce myself. I'm Dr. ALIA from Institute Cancer Negara. So back to our question. It is quite an interesting question, right? So to answer to that question, actually as in Malaysia, or I can say as in many other countries also, the treatment that we commonly use to treat cancer is actually radiotherapy and chemotherapy. But many have started to use gene therapy to treat cancer, or what we call cancer gene therapy. Well, as mentioned as Dr. Laily earlier, and IFFAH also, Ms. IFFAH also have stated earlier that gene therapy seeks to alter the genes to correct the genetic defects and thus prevent or cure genetic disease, while genetic engineering aims to modify the genes to enhance the capabilities of the organism beyond what is normal. So we can see the connection of gene therapy and genetic engineering here, right? So, well, the broad field of gene therapy promise a number of innovative treatments that are likely to become important in preventing death from cancer. And I would like to highlight this one approach of gene therapy treatment, which is gene transfer. Now, gene transfer actually involves the application of genetic engineering. Generally, these approaches are based on the employment of genetically engineered vectors that promote the transfer of the transgene expression unit into the tumor cells and allow transient or stable expression of the therapeutic gene. It is a radically new treatment paradigm involving the introduction of a foreign gene into the cancer cell or surrounding tissue cell and can cause cell death or slow the growth of the cancer. So to put this in a simple sentence, the vector actually we genetically engineered the vector, and the vector contains the genes that can cause the cancer cell to kill the cancer cell and to reduce the growth rate of the cancer cell. So this treatment is actually very flexible, and a wide range of genes and vectors are being used in clinical trials with a very successful outcomes. Actually, many specialists have actually used this technique and they have come with a very good outcomes. So this is how genetic engineering is applied in gene therapy and how gene therapy can help in cancer treatment. So thank you.
Thank you, Dr. Alia. Moving on to the next question, Ms. Lina, as a medical scientist in National Cancer Society Malaysia, in your opinion, what are the potential risks and are there still any problems or ethical issues regarding gene therapy that need to be addressed in today's time?
Thank you, IFFAH, for the very good question. And as you guys all aware, I am Nurul from the National Cancer Society Malaysia. And as a member of the NCSM, I am really hoping for the best outcomes and cure for every cancer that exists. And when I found out about the advanced technology of gene therapy to treat and cure cancer, I am very grateful and overly excited that we can finally treat this horrible disease. Gene therapy holds so many promise to treat many diseases. However, in my observation and through my personal opinion, there are still some issues and potential risks that are still not addressed enough. Regarding gene therapy, general potential risk could include certain types of cancer, allergy reactions, and damage to organs or tissues if an injection is involved. As we are all aware that gene therapy involves the usage of vectors to insert the gene into the cell. And the most common vectors that are being used in gene therapy are viruses. Therefore, some of the potential risks that could occur due to this action are unwanted immune system reaction, as our body's immune system may see this newly introduced virus as intruders and attack them, causing inflammation or even worse, organ failure. Not just that, it also might cause the possibility of developing a tumor if new genes get inserted in the wrong spot at DNA. And allow me to share some of the current research on gene therapy treatment in the US that has now focused on targeting the germ cell, which consists of sperm and egg cells. That allows the genetic to be passed through to the future generations, unlike the previous treatment that involves the somatic cells only, and the genetic alteration could not be passed down. This new approach is known as germline gene therapy, and it has been the newest ethical controversial, as it might affect the development of a fetus and in unexpected way, and it could give a long-term side effects that are not yet known. And since we are in short of time, so far that is all I can share to you guys. And I hope in the future we can think the solution about the issues regarding gene therapy together. Thank you. That's all from me.
Thank you, Ms. Lina. Since we have been explained about the issues and potential risks of gene therapy, it would be so nice if you get to know the benefits of this gene therapy itself. So I would like to invite Ms. Siti Nurdinah, a professor of pharmacy from IMU, to share some knowledge.
All right. Thank you so much for the question, Ms. Moderator. All right. So proceeding to the question, in the future, genetic therapies may be used to prevent, treat, or cure certain inherited disorders such as cystic fibrosis, alpha-1 antitrypsin deficiency, hemophilia, beta thalassemia, and also sickle cell disease. And they also may be used to treat cancers, just like what Dr. SYAHIRAH and Ms. Lina mentioned before. Not only that, they also can be used to treat infections, including HIV. Alright, so for further information, genetic therapies that are currently approved by the Food and Drug Administration, or well known as FDA, are available for people who have Leber congenital amaurosis, which is a rare inherited condition that leads to blindness. Also, there is a therapy called CAR T-cell therapy, which is FDA approved as well for people who have blood cancers, such as acute lymphoblastic leukemia, or in short term, we call it as ALL. And another example is diffuse large B-cell lymphoma. All right. In addition, let me go through to the surface of some examples of conditions that may be treatable with this gene therapy itself, which are the first one is cystic fibrosis. It is an inherited disorder in which thick mucus is produced, which is there is a clogging the airways and blocking the secretion of digestive enzymes. And also the second one is sickle cell disease, which is an inherited disorder that results in abnormal hemoglobin production, which is it occurs when the protein that carries oxygen in the red blood cells. All right, so the last one is Leber's hereditary optic neuropathy. We call it as LHON, which is it is an inherited disorder that causes the death of cells in the optic nerve, where it can result the damage to central vision. All right, I think that's all from me. Thank you.
Thank you, Ms. Siti Nurdinah. Finally, we have arrived at our last question. So, Ms. Nur Atia, as a biology student, can you tell the strategies that you know from your knowledge?
Thank you for the question, Ms. Moderator. Some of the gene therapy enhancement strategies include improving performance by increasing muscle mass, endurance, memory and cognition, and bettering appearance by controlling weight, height, and hair growth. There are few main gene therapy strategies. First strategy is immune regulation. The gene of antibody, antigen, or cytokine is introduced into the patient's body to change the immune state and achieve the purpose of prevention and treatment disease. Second, gene silence known as gene inactivation. Using antisense RNA, ribozyme, or nuclear platelet to inhibit the expression of some oncogenes, inhibit the proliferation of tumor cells, and induce the differentiation of tumor cells. This strategy also can block the expression of drug-resistant genes in tumor cells and improve the efficacy of chemotherapy. The last one is gene replacement. The normal gene is used to replace the pathogenic gene in situ so that the DNA in cell is completely restored to normal. That's all from me. Thank you.
Thank you, Ms. Nur Atia. Thank you for all the panels for the informative and interesting talk. Now we know that there are various applications where genetic engineering is used in gene therapy. We also get to know various other things that relates to the applications of genetic engineering in therapy. Ladies and gentlemen, we have reached the end of our forum today. I believe that we have gained a lot of knowledge and new information from our forum session. I would like to thank again all the ladies and gentlemen and also our panels for participating in our forum today. Thank you for your attention. Assalamualaikum and good night.